Namaskara. I'm Dr. Mallinath, working as a senior orthopedic surgeon in Manipal Hospitals, Bangalore. Today I will talk on osteoporosis, its causes, prevention, and treatment aspects. What is osteoporosis? Osteoporosis is a condition that affects the bones. Its name comes from the Latin for porous bones. The inside of a healthy bone has a small spaces like a honeycomb. You can see on the top of the figure. In osteoporosis, the size of these spaces increases, causing the bone to lose strength and density. Why should you be concerned about osteoporosis? Because 1 in 2 men over the age of 50 years will have a fracture of the bone because of the osteoporosis. 1 in 4 men over the age of 50 years will have a fracture of the bone because of osteoporosis. In women over the age of 45 years, account for more days spent in the hospital than diabetes, heart attack, and breast cancer. And more than 25% of the patients over the age of 60 years who sustain a hip fracture due to osteoporosis will lose their life in the first year of fracture, and 40% of the patients with a hip fracture will become dependent on others for their day-to-day activities. Many people don't know they have osteoporosis until their first fracture, which is why it is called a silent disease. Even after a break, it often goes untreated. The impact of hip fractures. Hip fractures result in a pain, reduced mobility, disability, and an increasing degree of dependence on others. Hip fractures are one of the main reasons why older people lose their independence. After a hip fracture, 10 to 20% of the patients who used to live in a community will require long-term nursing care. Almost 1 in 5 people die in the first year after suffering a hip fracture, and greater risk of dying may continue for at least 5 years afterwards. People who survive a hip fracture often suffer a loss of physical function and independence. 40% are unable to walk independently, and 60% still require assistance a year later. 30% are totally dependent or in a nursing home in the year following hip fracture. The impact of spinal fractures. Vertebral fractures or spinal fractures can lead to back pain, loss of height, deformity, immobility, increased number of bed days, and even reduced pulmonary function. Vertebral fractures significantly affect the ability of the people to carry out activities of daily living. Besides their impact on quality of life, they can result in loss of self-esteem, distorted body image, and depression. After hospitalization for a vertebral fracture, there is a greatly increased risk of requiring hospitalization for a further fracture in the years following initial hospitalization. The overall socio-economic impact of fragility fractures. Beyond the personal impact on millions of people around the world, fractures caused by osteoporosis represent a major and a growing socio-economic burden, causing huge direct cost for medical, hospital, and surgical care. Rising indirect costs that result when patients lose their independence and require nursing care either at home or in institutions. Loss of working days and income among adults who are still active in the workplace. Burden of disability. In many countries, fractures caused by osteoporosis are responsible for more days of hospitalization among women over 45 years of age than most other diseases. Causes for osteoporosis. Your bones are in a constant state of renewal. New bone is made, old bone is broken down. When you are young, your body makes new bone faster than it breaks down old bone, and your bone mass increases. After the early 20s, this process slows. Most people reach their peak bone mass by age of 30. As people age, bone mass is lost faster than it is created. How likely you are to develop osteoporosis depends partly on how much bone mass you attained in your young age. Peak bone mass is somewhat inherited and varies also by ethnic group. The higher your peak bone mass, the more bone you have in the bank, and the less likely you are to develop osteoporosis as you age. Risk factors for the osteoporosis. A number of factors can increase the likelihood that you will develop osteoporosis, including your age, race, lifestyle choices, and medical conditions, and medicines you take for the conditions. There are some unchangeable risk factors are there. Some risk factors for osteoporosis that are out of your control. These are your sex. Women are much more likely to develop osteoporosis than are men. Age. The older you get, the greater the risk of osteoporosis. Race. You are at a risk of osteoporosis if you are a white or of a Asian origin. Family history. Having a parent or a sibling with osteoporosis puts you at a greater risk, especially if your mother or father fractured a hip. Body frame size. Men and women who have a small body frames tend to have a higher risk of osteoporosis because they might have less bone mass to draw from as they age. Hormone levels. Osteoporosis is more common in people who have too much or too little of certain hormones in their bodies. Some of the hormones include sex hormones. Lowered sex hormone levels tend to weaken bone. The reduction of estrogen levels in women at menopause is one of the strongest risk factors for developing osteoporosis. Men have a gradual reduction in testosterone levels as they age. Treatments for prostate cancer that reduces testosterone level in men, and treatments for the breast cancer that reduces estrogen levels in women are likely to accelerate bone loss. Thyroid problems. Too much thyroid hormone can cause bone loss. This can occur if your thyroid is overactive, or if you are taking too much of thyroid hormone medication to treat an underactive thyroid condition. Osteoporosis also has been associated with overactive parathyroid and adrenal gland function. Dietary factors. Osteoporosis is more likely to occur in people who have low calcium intake. A lifelong lack of calcium plays a role in the development of osteoporosis. Low calcium intake contributes to a diminished bone density, early bone loss, and an increased risk of fractures. Eating disorders. Severely restricting food intake and being underweight weakens the bone in both men and women. Gastrointestinal surgery. Surgery to reduce the size of your stomach or to remove part of the intestine limits the amount of surface area available to absorb nutrients, including calcium. These surgeries include those to help you lose weight and for other gastrointestinal disorders. Steroids and other medications. Long-term use of oral or injected corticosteroid medications such as prednisolone and cortisone interferes with the bone rebuilding process. Osteoporosis has also been associated with medications used to combat or prevent seizures, gastric reflux, cancer, transplantation, rejection. Some medical conditions cause osteoporosis. The risk of osteoporosis is higher in people who have certain medical problems such as celiac disease, inflammatory bowel disease, kidney or liver disease, cancer, lupus, multiple myeloma, rheumatoid arthritis. Lifestyle choices. Some bad habits can increase your risk of osteoporosis. Examples include sedentary lifestyle. People who spend a lot of time sitting having a high risk of osteoporosis than do those who are more active. Any weight bearing exercises and activities that promote balance and good posture are beneficial for your bones, but walking, running, jumping, dancing, weightlifting seem particularly helpful. Excessive alcohol consumption. Regular consumption of more than 2 alcoholic drinks a day increases your risk of osteoporosis. Tobacco use. The exact role of tobacco plays in osteoporosis is not clear, but it has been shown that tobacco use contributes to weak bones. Complications of osteoporosis. Bone fractures, particularly in the spine or hip, are the most serious complications of osteoporosis. Hip fractures often are caused by a fall and can result in disability and even an increased risk of death within the first year after the injury. In some cases, spinal fractures can occur even if we have not fallen. Bones that make up your spine can weaken to the point of crumpling, which can result in back pain, loss of height, and hunched forward posture. Coming to the prevention, good nutrition and regular exercise are essential for keeping your bones healthy throughout your life. Protein is one of the building blocks of bone. However, there are conflicting evidence about the impact of protein intake on bone density. Most people get plenty of protein in their diets, but some don't. Vegetarians and vegans can get enough protein in the diet if they intentionally seek suitable sources such as soya, nuts, legumes, seeds for vegans and vegetarians, and dairy and egg vegetarians. Older adults might eat less protein for various reasons. If you think you are not getting enough protein, ask your doctor if supplementation is an option. Body weight. Being underweight increases the chance of bone loss and fractures. Excess weight is now known to increase the risk of fractures in your arm and wrist. As such, maintaining an appropriate body weight is good for bones just as it is for health in general. Calcium. Men and women between the ages of 18 and 50 need 1000 milligrams of calcium per day. This daily amount increases to 1.2 grams when women turn 50 and men turn 70. Good sources of calcium include low fat dairy products, dark green leafy vegetables, soya products, calcium fortified cereals, and orange juice. Vitamin D. Vitamin D improves your body's ability to absorb calcium and improves bone health in other ways. People can get some of their vitamin D from sunlight, but this might not be a good source if you live in a high latitude, if you are housebound, or if you regularly use sunscreen or avoid the sun because of the risk of skin cancer. To get enough vitamin D to maintain a bone health, it is recommended that adults aged between 50 and 70 get 600 international units and 800 international units a day for up to age of 70 through food or supplements. People without other sources of vitamin D and especially with the limited sun exposure might need a supplement. Remove exercise. Exercise can help you build strong bones and slow bone loss. Exercise will benefit your bones no matter when you start, but you will gain the most benefits if you start exercising regularly when you are young and continue to exercise throughout your life. Combine strength training exercises with weight bearing and balance exercises. Strength training helps strengthen muscles and bones in your arms and upper spine. Weight bearing exercises such as walking, jogging, running, stair climbing, skipping, skiing, impact producing sports affect mainly the bones in your legs, hips, lower spine. Balance exercises can reduce your risk of falling, especially as you get older. Swimming, cycling, and exercising on machines such as elliptical trainers can provide a good cardiovascular workout, but they don't improve your bone health. Movements to avoid. If you have osteoporosis, don't do the following type of exercises. High impact exercises. Activities such as jumping, running, or jogging can lead to fractures in a weakened bones. Avoid jerky, rapid movements in general. Choose exercises with the slow, controlled movements. If you are generally fit and strong despite having osteoporosis, however, you might be able to engage in somewhat higher impact exercises than can someone who is frail. Bending and twisting, you have to avoid. Exercise in which you bend forward at the waist and twist your waist, such as touching your toes or doing sit ups, can increase your risk of compression fractures in your spine if you have osteoporosis. Other activities that may require you to bend or twist forcefully at the waist are golf, tennis, bowling, and some yoga poses. Avoid smoking and excessive alcohol use. Along with eating a balanced diet and staying physically active, other lifestyle factors can affect bone health, including not smoking and limiting alcohol consumption. Researchers indicate that smoking can increase the rate of bone loss. Women who smoke have a lower estrogen levels than women who don't smoke. Smokers also tend to undergo menopause earlier than non smokers, and cigarette smokers tend to be thinner. All of these factors can increase the risk of osteoporosis and fractures. Studies indicate that consuming more than a moderate amount of alcohol can hasten bone loss and reduce your body's ability to absorb calcium. Medications for osteoporosis prevention. Medications are often prescribed for people at high risk of developing osteoporosis. Most prescription medications for osteoporosis are called bone anti-resorptive agents or medicines. The term refers to the action of slowing or stopping the breakdown of bone tissue. By putting the brakes on bone removal, anti-resorptive agents can help bone formation keep pace. This often allows density to increase over time. Common drugs used for this purpose include biphosphonates such as alendronate, ibudronate, and risodronate. And roloxifene calcitonin are also used. Preventing osteoporosis. You can help prevent osteoporosis by leading a bone healthy lifestyle at all stages of life. In fact, osteoporosis prevention begins in childhood when our bone healthy diet and plenty of exercise helps children achieve their highest possible peak bone mass. This is important because the more bone mass you have when you are reach childhood, the less likely you are to have weak and breakable bones at older age. Build strong bones in children. For women, early prevention is important. What can you do as an adult to prevent osteoporosis? As an adult, you can do many things to help maintain healthy bones and to avoid premature bone loss. Making simple changes to your diet, taking enough exercise, and kicking bad lifestyle habits will not just help you to prevent osteoporosis but will also benefit your general well-being. Osteoporosis prevention strategies in seniors. Older adults are at highest risk of osteoporosis, with nearly 75% of the hip and spine and wrist fractures occurring in people aged 65 years old or over. The prevention advice is very important. They ensuring enough calcium, protein, vitamin D, other nutrients is very important in old age. With the age, your ability to absorb vitamins and minerals may be reduced. In fact, older adults often suffer from malnutrition as they may not be eating enough and getting enough protein and vitamins in their diets. A calcium and vitamin D supplement should be considered when dairy consumption is low and little time is spent outdoors. Participating in exercise activities that improve balance, posture, coordination, and muscle strength. As we age, we lose both bone and muscle mass faster, so exercise becomes even more important. In addition to regular weight bearing physical activity, older adults should choose exercises which help improve balance and muscle strength. Diagnosing osteoporosis. Men and women over 60 years of age are at higher risk of osteoporosis than younger people. Nevertheless, it is possible to have osteopenia or osteoporosis at a much earlier age. As osteoporosis has no obvious symptoms, it is important to go to your doctor if any risk factors apply to you. By making a positive lifestyle changes and following appropriate treatment strategies in consultation with a doctor, osteoporotic fractures can be prevented. Your doctor will take a thorough medical history that includes information on any recent fractures and may determine the next step is to have a bone mineral density test. What is a BMD test? A traditional X-rays cannot measure bone density, but they can identify spine fractures, bone fractures. To some extent, we can predict the density of the bone. To measure it correctly, bone density test is required. Has to be measured by sophisticated technique. A number of different types of BMD tests are available, but the most commonly used is DEXA, dual energy X-ray absorptiometry. What do test results mean? The World Health Organization has defined a number of threshold values for osteoporosis. The reference measurement is derived from bone density measurements in a population of healthy young adults, called a T-score. Osteoporosis is diagnosed when a person's BMD is equal to or more than 2.5 standard deviations below this reference measurement. Osteopenia is diagnosed when the measurement is between 1 and 2.5 standard deviations below the young adult reference measurement. If the results of your BMD test show osteopenia or osteoporosis, it does not automatically mean that you will have a fracture. There are lifestyle changes and number of available therapies that your doctor might prescribe to slow down your bone loss and help to prevent osteoporotic fractures. Importance of sticking with treatment. Like all medications, osteoporosis treatments can work only if they are taken properly. As reported for other chronic diseases, up to half of patients with osteoporosis stop their treatment after only 1 year. If you have been prescribed osteoporosis medications, you should keep in mind that by adhering to your treatment, you can benefit from larger increases in BMD, you lose less bone mass and reduce your fracture. Unlike when you take medication for any infection, you will not be able to tell if the osteoporosis treatment is effective. That is why good communication between you and your doctor is important. If you have any questions or concerns, don't stop medications without discussing options with your doctor. Stopping the treatment will increase your chances of having a fracture, which can have a life-changing consequences. In addition to drug therapy, calcium and vitamin D supplements can be prescribed to ensure maximum effectiveness of your medication. should be aware that attention to lifestyle factors, including risk factors, nutrition, exercise, must go in hand with any drug treatment. Conclusion: osteoporosis is a common condition and it is a serious condition. Fractures caused by osteoporosis can be life threatening and a major cause of pain and long term disability. To prevent osteoporosis, exercise regularly, ensure a diet rich in the bone healthy nutrients, avoid negative lifestyle habits, find out whether you have a risk factors, get tested, treated if needed, take precautions and prevent falls in old age to prevent the complications of osteoporotic fractures.